What's the procedure?
My God! Okay, it's happening. Everybody stay calm.
What's the
Everybody
procedure,
stay calm.
everyone? What's the procedure?
Stay calm!
Hello again, everyone. Today we're going to be talking about the air in venous alarm. This alarm can be quite stressful, especially for newer hemo nurses, but I'm here to show you that it doesn't have to be and is generally easy to fix. Let's start off with how and why the air in venous alarm is tripped. The Artis Physio is equipped with an ultrasonic air detector housed just beneath the sensor bar door. The sensor is quite sensitive and easily tripped to prevent any air from reaching the patient via the venous line. If the machine suspects any air bubbles are present in the blood as it moves towards the patient, an air and venous line alarm will be triggered. This results in an immediate pump stop and activation of the venous clamp to prevent the air from reaching the patient. The air in venous may be accompanied by other red alarms, such as arterial pressure too low, venous pressure too high, or blood lines clamped. It's important to remember that you cannot clear the air in venous until the other red alarms have been resolved. The alarm itself is very loud and creates a sense of urgency. I recommend silencing the alarm so long as you are staying to resolve it and don't require other nursing support. You can select each red alarm individually by touching it. Correct the pressures as necessary and reset the alarm until only the air in venous remains. For detailed step-by-step instructions, with the air in venous alarm selected, touch Help. This will bring up a written and visual guide for resolving the issue. By tapping Next, you can cycle through each individual step. Note that this screen also gives real-time pressures for the venous and arterial chambers, as well as your current blood flow setting. This will come in handy later. I'll now walk you through my general advice based on these instructions. Firstly, if an air in venous is detected, don't panic. While it needs to be addressed promptly, we can show you how to do so. Silence the alarm and lower your pump speed setting to 100 milliliters per minute. Some patients are extremely sensitive to pump stoppages, and air in venous can occasionally be stubborn or difficult to clear. I found that restarting the pump with a high speed and rapidly returning this stagnant blood can result in a syncopal or pre-syncopal event for patients. A gentle, slow reinitiation of the pump can help mitigate these symptoms. To resolve the air in venous, you will need 2 blue clamps and 1 sterile 10 ml syringe. Take your first blue clamp and place it below the venous line machine clamp. Place your second blue clamp after the dialyzer on the venous line. We've now effectively isolated the section of the circuit which is suspected to contain air. Now, ensure the clamp is engaged on the venous access port. Remove and discard the tip, taking care not to contaminate it, and lure lock the 10 ml syringe to the port. Open the clamp and gently aspirate, keeping a close watch on your venous pressure. You want to continue to gently aspirate until you see it reach approximately minus 80 millimeters of mercury. At this point, hold your position and re-engage the clamp. If done correctly, you should hear the audible clunk of the venous line clamp releasing. The pump on-off button light will also begin to flash. At this point, we've isolated the section of the circuit with air and exerted a negative pressure on it. Now we will release the blue clamp, which is below the venous line clamp. In doing so, we will cause blood and any air to be drawn up by the negative pressure towards the venous chamber. Visually assess the tubing and chamber for any evidence of air. If you see additional air, you may continue to aspirate with the 10 ml syringe, drawing more blood and any air into the venous chamber. Once you're satisfied that no residual air remains, press the pump on-off button once to reactivate the pump. Once the pump is activated, remove the final blue clamp from below the dialyzer to prevent pressure alarms from occurring. With this, the air in venous should be resolved. I recommend gradually increasing the pump speed over a minute or two and monitoring your patient for any sensitivities to the pump stoppage. Because we aspirated from the venous chamber, after the alarm is resolved, you may need to adjust the chamber level. Gently instill a small volume of air to lower the chamber level, or aspirate to raise it. Now, let's talk about common issues and general troubleshooting. A very common occurrence I see is accidentally aspirating too aggressively. This substantially exceeds the required negative 80 millimeters of mercury in the venous chamber, which triggers new red alarms and prevents you from resolving the air and venous. This can fluster the nurse, as the machine will not allow them to restart the pump and the air and venous remains. If this occurs, take a moment. We can see here that the venous pressure is very low at minus 166 millimeters of mercury. In order to resolve these low venous pressure alarms, we need to relieve some of the negative pressure. Remember, our target is only minus 80. Release the venous port clamp, allowing the pressure to be relieved by the syringe. Gently aspirate until the venous pressure is approximately minus 80, then reclamp the venous port clamp. Now that the pressures have been resolved, reset the other red alarms individually. Now you may resume the steps for your air and venous. So what if the air and venous triggered, but there's no visible air? The air detector is very sensitive and can potentially be tripped by something other than air. In some cases it may be nothing at all, or the machine was simply bumped. In other cases it can be an indicator of circuit clotting or excess adipose collection within the tubing. Either way, treat each air and venous alarm seriously and carefully inspect for air. If you followed all of the above steps and still find you're getting recurrent air and venous alarms, you may find that the air detector requires cleaning. In some cases, the machine will even prompt you to do so. To clean the air detector, with the pump stopped and your clamps engaged, gently open the sensor bar door by pinching the rounded areas and hinging it to one side. Gently remove the venous line from the air detector and set it to the side. Using a microfiber cloth wetted with warm water, gently floss the venous line channel and the same portion of the venous tubing. Using a dry microfiber cloth, repeat the process to ensure no moisture remains. Do not use cleansers such as alcohol or chlorhexidine, as they may damage the sensor, and do not use gauze as it may leave residue. Replace the venous bloodline and close the sensor bar door until it clicks shut. Now, clear the air and venous as per normal. This should hopefully resolve the air detector cleaning required alarm and recurrent air and venous. If it doesn't and clotting has been ruled out, consider switching machines and reinitiating dialysis as necessary. Thanks so much for watching, and as always, if you find that you have any questions, please don't hesitate to reach out, or even if you just want me to elaborate on some of the concepts we discussed. Have a great day.